He jokingly calls himself a recovering plastic surgeon. He spent 25 years as a naval doctor and has turned his expertise into a thriving business called Next Health here in Southern California. Welcome, Dr. Darshan Shah. It's nice to have you here.
Thank you.
I call you Dr. Shah, but you're my buddy, Darshan.
I know, we've known each other a long time now.
I know, it's so great to have you here.
Thank you.
What I think is funny is you call yourself a recovering plastic surgeon. What the heck is that?
So, I've done a lot of different things in medicine. Like you said, I was in the Navy for a while. I was a trauma surgeon. I did reconstructive surgery for a long time, primary care, emergency, everything.
Wow.
And over the last 10, 15 years of my life, I did plastic surgery. And that turned into, from reconstructive, went into cosmetic. And what I noticed in my 10 plus years of doing cosmetic surgery was I was doing a lot of procedures that were making people look better on the outside, but not necessarily healthier on the inside. So I found myself a lot of times telling people, let's stop talking about the plastic surgery right now and let's start talking about your overall health instead. We need to get you physically, mentally, emotionally healthy before you do this plastic surgery procedure. And I call myself a recovering plastic surgeon because I talk to other plastic surgeons and they're just like, why do you do that? You must not have any business. And I, in fact, wrote a book about it called Making the Cut, 10 Reasons You Should Not Have Plastic Surgery. And I don't think that plastic surgery is bad or cosmetic surgery is bad, but what I do preach to people is get yourself healthy first. And that's where my new business came about, is really about helping people get healthy.
Okay, so let's rewind a little bit because I know that you became a doctor at a very young age. What motivated you to want to do that? I know that your family is very important to you. You're a very traditional family. Tell me about the early parts of Dr. Darshan Shah's. What motivated you to become a doctor in the first place?
Well, I mean, part of it was expectation from my parents. I'm from India, and you had two career choices, either an engineer or a doctor, and even being a lawyer was not necessarily considered a great thing. So, but I really had a true interest in science, and the reason I became a physician at a very young age was because I knew this is the path I wanted to follow. I saw my dad treat people with Ayurvedic medicine. My dad had a big career in health as well, and I just loved it. And the human body just fascinated me from a molecular level all the way up to doing surgery. Everything about it I loved.
And the Navy gave you what kind of a specific training that really changed your life?
So with the Navy, I was there as a reservist and working at their naval bases, treating the young.
In San Diego?
Yeah, in San Diego, and also in the middle of the country as well. When I went to medical school, I started when I was in medical school, and then continued on when I was a surgical resident in California.
Okay.
But I learned a lot of different things from all different places. So in the Navy, I learned about how young people need to stay healthy and what they need to be healthy on the long term. And just being physically fit doesn't mean that you're internally healthy. And I found that a lot in talking to these to the people that I worked with in the Navy. But then I also worked at the Mayo Clinic, where I saw the worst of the worst. That's what we call a tertiary referral center, where people come when regular hospitals can't help you anymore. So having this big varied career, and then I worked in lots of inner city emergency rooms, I got to see a lot of healthcare, and I got to see kind of how we're doing things totally wrong in the Western world with healthcare. We're so disease focused and not necessarily health focused.
When I hear the experiences that you've had, I look at you and I think you're 80 years old. How is it possible?
I look 80 years old?
No, you don't. Okay. And from the inside and out, you look fabulous. But the career, the extensive career that you have, has given you the path to Next Health. And I think this is the kind of the overall thing that you're accomplishing. So quickly tell me about Next Health, because we'll talk about that at another time.
Sure. So as I alluded to earlier, I really believe that our entire healthcare system is totally headed in the wrong direction. All we're doing is waiting for someone to become in a disease state and then prescribing them a pill to alleviate the symptoms, right? It's a disaster, and it keeps going in that direction. That's where all the money, research, everything is going. And what I want to do is be part of the change. And so what Next Health is, it helps people like yourself and I. Maybe your doctor tells you, you're not sick. Come back to me when you're sick, or maybe you're on one blood pressure medication or something. And
you described me perfectly.
Right, exactly. And you're like, but wait a minute, I don't feel good. Like there's more. I need to do more.
Right.
Well, that's what Next Health is. It's a place where you get that more, where we focus on everything that you can do to optimize your health, and we give you the technology that's been locked up in our hospital system for almost a century now. We give you access to blood work. We give you access to doing different things things that are very easy to do, that don't cause harm, but help you stay younger, reduce inflammation, and get to the root cause of the disease processes. When you treat the root cause of all of our disease, then you end up eliminating disease as a whole. So you get down to the root cause. That's what we do. Yeah.
Website?
Yes, next-health.com.
All right, Darshan Shah, the doctor, is here. Thanks so much for being with us this morning.
It was great to talk to you. Thank you.